Today we're going to be talking about questions and answers that people have asked last week. So we're going to be talking more about the virtual consultation feature and then just some kind of fun random Q&A that people had. I picked a few questions and we're going to run through them. So I'll go ahead and sort of get started. Let's see. Looks like it's a little choppy. So again, hi everyone. I'm Dr. Patti Haebe. I'm the medical advisor for Premom, and I'm sort of helping us big time launch this virtual consultation feature. My passion is connecting people with fertility resources, and especially with this coronavirus, it's so hard for people to get into reproductive endocrinologists, and even just getting into your OB right now is really tough. So we're just trying to find ways to connect people to resources that are going to be a good fit for them. So that's kind of my passion. I'm a naturopathic doctor. I have a focus in fertility and hormone optimization. And I've worked a lot just with optimizing hormones, general health and wellness, lots of women's health, and a big emphasis on fertility as well as preconception preparation specifically. I always say we spend like a year planning these big elaborate weddings, and then how long do we spend preparing our bodies for pregnancy? So I'm a bit advocate of looking into those hormonal cycles early, cleaning up your environment, optimizing nutrients. It's all so important. We're wonderfully made, but we could put some work in, right, to benefit our body through the conception process. So, just a little recap. Through the Premom app now, it's really neat. You can actually use your iPhone application to book a consultation with a fertility specialist. Let me pull up my Premom app just so I don't misspeak at where everything is. So when you go to your phone app, you're going to hit more, and you can click the button that says schedule a consultation. And from there, you can add your own OB, which is really cool. You can invite them to become a Premom provider. You just provide their name and their practice info, and we can connect them through Premom, so you can talk to them through here. Also, you can use the app to have doctors that are already available, so you can see doctors, nurse practitioners, fertility awareness method instructors. It's really kind of cool. We're creating a very cool and diverse database of fertility specialists, so we can kind of figure out whatever you need to fit your fancy. Okay, let's dig into questions from last week. So that's a virtual consultation feature. All those consultations take place on your phone. It's really cool. You can book the application, pay for the application, and do the application on your phone. You can do like a chatting. You can do video with your provider, or you can do just an online call. And it's all HIPAA compliant and secure. So although it's not a doctor's visit, it's just as safe as one is. Somebody had asked last week if there are going to be prescriptions. So we're not doing prescriptions at this time. The focus is really on not necessarily like medical advice and treatment, but on education. So our focus is on like cycle mapping and tracking, digging into your charts to see where problems might be arising, and providing some suggestions and changes. We're finding that a lot of people just need a little bit of extra guidance when it comes to learning how to track your cycle, use LH strips, use BBT, make sure your intercourse is timed correctly, feeling cervical mucus consistency. It's a lot. It gets very overwhelming, and some people are just missing it. So this is, a way for people to connect with specialists and say, am I doing this right? And then also for people to dig a little deeper and say, I want to talk to maybe a doctor or something and figure out like what are my next steps in reproductive endocrinology. Do I need to be requesting lab tests? What imaging? Like what does this look like? What are my options? And just giving you a time and a space to talk with a provider about those, spend 30 minutes sitting down and talking about stuff instead of, a quick in and out 10-minute visit maybe at your office. So it just kind of is helpful from that perspective. But yeah, so no prescribing and no lab testing at this time, although some practitioners do, give insight on labs that you can ask your local PCP or your obstetrician for, to maybe help advocate for yourself and dig in and figuring out what you're missing, or maybe it's something that your doctor hasn't thought of yet. It's really hard to stay on top of everything. So our goal is just to provide you those resources. The other question is it available for everyone or just in the States? So predominantly it's available in the States. However, we do have a whole international provider section, which is really cool. So we have, I know currently providers in Canada, we have providers in South Africa, and it's growing every day, which is kind of cool. So wherever you are, we're working on being able to cover that. Again, I would say the majority of clinicians are, or providers are here in the United States, but we do have a whole international category, which is kind of cool. Okay, next question. Somebody had asked last week, we talked about, someone had said, why do doctors say we have to wait a year before seeking out a fertility specialist? And I wanted to chat about this a little more because it's a fantastic question. So, the American College for Obstetrics and Gynecology, they kind of set the guidelines as far as infertility investigations go. And I'll read it verbatim to you. So it says infertility is defined as a failure to achieve pregnancy within 12 months of unprotected intercourse when in women younger than 35 or after 6 months in women older than 35. An infertility evaluation may be offered to any patient who by definition has infertility or is at a high risk of infertility. So that just means that a lot of doctors are not inclined to start digging into lab work and your cycles before you have been trying to conceive unsuccessfully for 12 months if you're under the age of 35 and 6 months if you're over the age of 35. And this is just sort of the guidelines that practitioners tend to follow. They're looking at statistics and probability and just looking at likelihood of conception in general. But the way that we see it, I think a lot of times when people are ready to start conceiving, they're kind of ready to go. It's like they want to rip the Band-Aid and move forward with their lives. And even after a couple cycles of not getting pregnant, it starts to kind of set something off in the back of your brain that's like, wait, what's wrong? I thought this is super easy. I thought like you sneeze and you get pregnant basically. So that's why we provided this as a resource. If your obstetrician is not willing to dig in, it's too early, we're providing resources that can help you to start digging into your fertility. And potentially it's something that we can help you figure out on your own ahead of time instead of waiting a year and then having, to figure out what the next steps are. So I think it just brings a big peace of mind, and it's just sort of a gap. And, medicine is not one size fits all. Medicine is medicine can be proactive and not reactive, and that's our focus here. So we're kind of flipping the script on fertility and being as proactive as we can in our approach. Okay, another question that okay, so now we're kind of just on to general Q&A. That's about it for the app. And if you have any questions, comment them, and we'll get to those again in the future about the VC future. VC, virtual consultations. What happens when there's male factor infertility on top of you having PCOS? Great question. So you get to work on sperm health while you're working on your PCOS. So what's really great is things that will probably benefit both of you are dietary and lifestyle changes. Antioxidants are so key for sperm quality. And then diet and lifestyle changes are so important for PCOS, right? So that's something that you guys can really do together. Again, I say take a deep breath, give yourselves 3 months, work on that diet and lifestyle, really, clean up your environmental toxins, increase that nutrient status, optimize those hormones, and you guys are going to be able to get there. So again, frustrating, but kind of the cool thing about it is you both have something you can work on, and there's motivation for both of you to come together as a team, and you get to start really the parenting journey ahead of time early, supporting each other and coming together in this process. So, here's another question about the virtual consultation feature. How much does it cost? Great question. So consultations, again, we have a variety of specialists. So we have anything from MDs, NDs, DOs, nurse practitioners, nurses, fertility awareness method instructors, health and wellness coaches. So costs vary just between starting at $40 and goes up to $200 depending on the specialist. And what's really cool is you get to pick whoever you want to. You can scroll through. There's bios for all the different providers. You can read a little bit about them, what their practice style is, and then from there, you can decide if you want to move forward and book with them. So it's really cool because we're finding you a good fit for you. It's really important. Okay, another question. PCOS. This person says that she's not insulin resistant and has normal testosterone levels, but still elevated LH and FSH and LH. What is the best method of treatment? This is a good one. So PCOS is a tricky one, and a lot of people get kind of thrown under this category, this general category of PCOS, but not everybody fits the picture exactly. And I think there's kind of two types of PCOS that I see that people end up in. And this is a super common one, and the standard metformin isn't really going to do the trick. With these people, the biggest thing I see is stressors being a huge issue. Stressors to the adrenal glands. So your adrenal glands are these little glands that sit on top of your kidneys. And when we're really stressed out, they crank out this hormone called cortisol, which is really good. It actually helps us deal with all the epinephrine and norepinephrine we're secreting. But in order to make this cortisol to keep up with our maybe super intense lifestyle, it can pull from our sex hormones. And a big one that it steals from as a precursor to cortisol is progesterone. So I see this really messing with cycles. So my biggest advice in these cases is manage stress. And stress looks different to every person. You may not feel stressed, but you could be still stressing your body. For example, people that love to do like high intensity, like Orange Theory type classes or spin classes like 2 times a day or, every single day. Those can cause, while you enjoy them, they can cause a huge stress on your body over time if your body perceives that as stress. Also, people who are not eating consistently. A lot of times with this, I recommend eating like 6 small meals a day because your body can see like dips in blood sugar as a sign of stress. So really you want to modulate that blood sugar. So managing stressors is a big place I would start with that. It sounds kind of funny, but I see good results with that. Okay. Excuse me. I have a scratchy throat from talking so much. The air is dry. Okay, why do my strips always say low or 0? Okay, your LH is low. Why? I know I sound like your 2-year-old maybe, but let's dig in and investigate why. Why is your LH low? So let's do a quick physiology lesson, okay? We have estrogen. It's in your uterus and your ovaries. It's helping your endometrial lining get nice and thick and juicy, ready for implantation. And it gets really high to a point, and then it goes into your bloodstream and it tells your anterior pituitary in your brain, I think we're ready to ovulate. Let's go ahead and pop out an egg. This estrogen surge triggers LH, which is going to go from your anterior pituitary down to your ovaries and says, hi ovaries, time to release an egg. If this isn't happening, then we're missing something in that communication between your ovaries and your brain. So if your strips are always saying low or 0 for that luteinizing hormone, there's a reason that your brain and your ovaries aren't really communicating. That could be a lot of different reasons. So it's definitely something to look into. So again, if those LH strips are, seeming a bit wonky, it's time to like dig in, work with a specialist and figure out what's going on. Okay, next question. Does marijuana use impact a man's sperm or a woman's fertility? With so many states making it legal and so little research, I think this is an area many have wondered about. Absolutely. Really great question. So for starters, THC specifically, we do see an issue with sperm quality. And I always recommend that men stay away from it. There's, for example, we know that marijuana does inhibit pituitary function, just like exogenous testosterone inhibits pituitary function. So these are things that we don't want to do because they're going to inhibit the way the testes receive information from the brain to create sperm. So I always say best to kind of lay off on that. That being said, there is some new research that I've seen that's been going on about CB receptors in the uterus. I've actually seen a few fertility clinics that have been doing some trials with CBD with improved implantation rates. But again, that research is not out yet. So I always say it's best to steer clear of it. I love it. I think it's, has a lot of really good uses. The fertility world, I think it's a good thing to just back off on from now, especially because there's not black and white evidence for its benefits right now. So stay safe. Okay, does Mucinex affect you in a bad way if taking it to try and get pregnant? Good question. I actually it's very funny timing with this because I just wrote a blog article for Premom about this. It's a super common question. What's the deal with Mucinex in your cervical mucus? So it depends on your cervical mucus. It can be helpful. It's theorized that it could be helpful if you are not getting that egg white consistency cervical mucus. It can help thin that out and allow sperm to get through and be able to swim up and into your uterus and meet that egg. However, that it's a valid theory. Mucinex is a mucolytic. It breaks those bonds in the mucus and it also increases water production to help smooth out that mucus. They've also found that increasing your water intake also can help benefit your egg white cervical mucus. So, before you take a drug, I always say it's a great idea to try, making sure that you're as healthy as you can be, right? You have the good foundations for health. There's something else I wanted to say about that. Oh, also, egg white cervical mucus is caused by an increase in estrogen. If you're not getting that estrogen spike, that could be a significant issue in the way your endometrium is building up appropriately and the way your ovaries are talking to your brain. So I would say definitely take a deeper peek into that as well if you're never getting the egg white cervical mucus, because you do want that really beautiful fertile mucus. Okay. Just a couple more questions and then we'll wrap it up. My husband and I are on our third month of trying to conceive, and every time we have sex, I am in pain. It kind of feels like a stabbing pain. Is this common when ovulating? Great question. So pain during intercourse is always something worth investigating. So I definitely would recommend chatting with your doctor directly about what's going on. You may need an ultrasound. The reason why, when you ovulate, it is common that you can get an ovarian cyst with that ovulation, especially if it doesn't rupture and let that egg out. And when you have that kind of unruptured cyst on your ovary, it can cause pain with intercourse. So it could be you haven't ovulated yet, or you did not ovulate this cycle and you do have that anovulatory cyst. So typically not an issue, but definitely worth talking to your doctor about just to make sure everything's okay. Again, pain with intercourse can be a lot of different things. It can be something also like endometriosis, but it also can be something serious like pelvic inflammatory disease. So the key is to definitely investigate and chat with your doctor. Okay, and then so last question for today. Is it okay to ovulate late in your cycle? Does this signal that something is wrong? Great question. If this is normal for you and you will ovulate, your follicular phase is pretty long, totally fine. Some women have longer cycles. Some women average 35, 40-day cycles, and that's just them. There's nothing wrong with that. However, the one thing I will say is confirm that you are ovulating. So use LH strips, use basal body temperature, even progesterone strip testing on, around 8 days past ovulation to be sure that you are ovulating. That would be the one thing I would say, because you really can have periods without ovulating. You can have these long cycles that looks like maybe you did, and then you get a period so you think you ovulated, but you may not have. So that's why it's really important to do a combination of tracking using LH strips, basal body temperature strips, specifically just to confirm that ovulation. So that would be my recommendation, but it could be completely normal for you. What's cool, is we're all so uniquely and wonderfully different, but it also makes it tough because we all don't fit into the cookie cutter of perfect menstrual cycles when it comes to conception. All right, well, I think that's it for today. Those are all the questions we're going to do. But we'll definitely be doing this regularly. So be on the lookout if you have additional questions in the future, and we'll get them answered for you. So I hope you guys got a lot out of this, and I will look forward to next time. Have a wonderful weekend, guys.